Hello, friends. Welcome to the show and welcome one and all. We have with us a young, dynamic, celebrity dentist, Dr. Khushal Gangwani, with us. Dr. Khushal is an oral and maxillofacial surgeon. Doctor, would you like to introduce yourself in brief, how you
Oh,
began with your career as a dentist?
yeah. So, hi friends, myself Dr. Khushal Gangwani, consultant oral and maxillofacial surgeon from Juhu, Mumbai. And I am the chief dental surgeon at Oramax Dental Clinic in Mumbai. So, yeah, since my early childhood days, I always wanted to become a doctor, a surgeon to be more precise. And when I was in college, I was always looking forward for my biological practical classes where I used to get to do dissection of the frog and cockroach. And after my 12th, I gave my CET exam and I missed getting MBBS just by 2 marks. But then my second preference was dentistry. So I got into the Government Dental College, Mumbai in 2008, and I graduated from Government Dental College in 2013. After which I did my post graduation from DY Patil Dental College in 2015, and I completed in 2017. So after that, I did a couple of fellowship in observership in cleft and oncosurgery. And 1 year back, I started my own dental clinic, that is Oramax Dental Clinic in Juhu, Mumbai. Yeah.
Oh, long journey through, though, in this short duration. It's a long journey. Nice to know that. Doctor, I would like to know what is the major risk in nowadays young individuals having oral cavities? Is it more so due to bad eating habits or in general they are neglecting oral hygiene?
Well, that is a fact. According to World Health Organization, dental caries or tooth decay in permanent teeth is one of the most common, in fact, the most common health condition. And according to statistics, more than 530 million children suffer from dental cavities each year worldly. So, coming to the question why there is a risk of dental cavities is that basically, whenever we eat or drink anything which has sugar in it, forms a layer of plaque on the teeth. Now, this plaque, uh, when it's there for a long time, it produces acids which destroy the teeth and it forms a cavity. So, due to increasing consumption of junk foods such as biscuits, chocolates, ice cream, bakery products, bread, so there is an increased risk of dental cavities due to the constant accumulation of plaque and acids on the teeth. So we can prevent this dental cavities by reducing the intake of high sugars and refined carbohydrates, and also by maintaining excellent oral hygiene by brushing twice a day with fluoridated toothpaste and with the correct brushing technique.
Yeah, I or our audience would love to know because in today's world, with so many brands and companies claiming themselves to be the best in oral hygiene or maybe ranking number one, which toothpaste and toothbrush would you recommend, sir?
Oh yeah. So personally, I'm not a very big brand endorser of any particular
Good to
toothpaste
know
or
that.
toothbrush.
Good to know that.
But I would say that the American Dental Association ADA recommends brushing your teeth twice a day with a fluoridated toothpaste with which is something called as a modified bars technique. So this is your toothbrush. So you just have to brush your teeth vertically rather than horizontally because most of the people brush your teeth in this motion. So you should
Hmm.
always brush it vertically or in circles everywhere, and you should brush for at least 2 minutes 2 minutes at a time. So we have certain things called as a power toothbrush, which has just a press a button and it rotates and vibrates for 2 minutes and it stops. So this is a very important, useful tool which I recommend to my patients. And also you should use a fluoridated toothpaste, be it any toothpaste. I don't endorse a particular brand, but if you have a sensitive teeth, which is sensitive to hot and cold food, you can use a Sensodyne toothpaste. And if you don't have your teeth are healthy, then you can use any toothpaste. Doesn't matter. Just follow the right brushing technique with the correct method and correct frequency. That is minimum 2 times a day, once in the morning and once at night before going to bed. And apart from brushing, there's also one more important tool, which is something called as a water pick or water flosser. So this has a water tank in it, which you can use some mouthwash or water in it, and you can press this button, which releases water with a forced pressure. This helps in removing 98% of plaque from your teeth. So all you have to do is just press on this button and move it across your teeth like this. So this helps in cleaning all the plaque and food which is stuck in between the two teeth. It acts like a flossing machine. So these two things I usually recommend: a powered brush and a water flosser.
Oh, nice innovative method, water floss. New for us to know. Uh, Doctor, what innovative things are coming into dentistry? I came on hearing something called as invisible braces. Can you tell us something? What are these?
Well, invisible braces comes with the brand name Invisalign. Many of you must have heard on social media, on different posters. Pariniti Chopra is advertising this Invisalign. So what is this Invisalign? Invisalign is nothing but removable, transparent, invisible braces, which it has a lot to do with smile designing. So we do a lot of smile designing cases in a clinic where we implement the use of invisible braces. So this is nothing but removable, transparent kind of braces which are put in and which has to be worn for 20 to 22 hours a day, and it works exactly like braces in moving the teeth, and it closes the gap, corrects the different kinds of crowding of teeth and spacing of teeth, but it has to be worn for a fixed time, that is 20 to 22 hours. That it requires a lot of patient compliance. So it is a magical thing. It is more effective than braces, and it takes lesser time than braces, and you can eat everything with it. You just have to remove it when you're eating and when you're brushing, otherwise you have to keep it on. So there are many advantages, but it requires strict patient compliance. Apart from braces are something which you cannot remove, but
Hmm.
invisible braces you have to remove it only while eating and brushing. That's the latest thing, upcoming trend in dentistry.
So with this, I mean to say, though it is very convenient, easy to use, but it has a tagline called as compliance. You have to wear it for at least 20 to 22 hours. Though you can
That's
remove
correct.
those, okay. Sir, I would like to also know what are the new or latest upcoming trends in dentistry?
Oh, well, yeah, there are a lot of recent technologies and trends and advances in dentistry. And there are many, a plethora of advances, but I would like to elaborate only on five advances, which
Okay.
I particularly follow in my practice. The number one is digital X-ray, which is also called as RVG, radio visiography. So gone are the days when we had this traditional films which we had taken an X-ray with a big machine and had to develop and expose those films. It was a lot of time consuming process. But with the
Yes.
advancement of this X-ray, you can take dental X-rays with a snapshot like this within a couple of seconds. And it can be visualized by the patient and the doctor on the screen in front of your chair. That is an advanced technology. Also, it has like 6 times lesser radiation exposure than the conventional X-rays. The second one being dental lasers. So lasers are nothing but an important tool in dentistry which has made dentistry less painful and more predictable. So lasers can be used for gum diseases, for teeth whitening, for cavity cutting, and a plethora of applications in dentistry. It reduces the need of dental anesthesia. It is absolutely pain free, and the outcomes are much better and very predictable. That's another thing. The third one is dental implants. So dental implants are nothing but titanium screws which goes inside the jaws, and it is used to replace the missing teeth. So in the conventional procedure, we had bridges. Bridges make use of they have to grind the front and the back tooth, and you have to replace the tooth with the help of bridge. But nowadays, dental implant is very much effective in that you have to replace only the missing tooth without touching the adjacent teeth. So that is another big breakthrough in dentistry. The fourth one is an intraoral camera. So this intraoral camera is a handheld device which takes it, we use it when the patient walks in for an OPD consultation. it can be used to take photographs and videos of certain inaccessible areas of the teeth where you cannot see the cavities with your visual naked eye. So it magnifies the view and you can show to the patient, you can educate the patient that he or she has the cavity in the back tooth, like that. The fifth one is Zoom teeth whitening. Zoom teeth whitening is a very good latest state-of-the-art equipment which enhances the teeth whitening procedure. It is a photo stimulation kind of a teeth whitening which gives you 8 shades whiter teeth in just 30 minutes. So these are some of the recent trends and advances in dentistry. There are many more. There's something called a stem cell therapy in the future. Who knows that we may able to generate a whole tooth out of the stem cell. So we are in the breakthrough of dentistry right now.
Well, plenty of things coming up in with this new technology and science. And as you said, who knows? Stem cells may also play a big role with creating a new tooth itself. Wow, it can happen, possible, always. Doctor, what makes patients come to you or visit you? Is it more often due to a need based? They have some cavities or say toothache like that, or do they come for they want something what do you say aesthetic appeal or a good pleasant look so that there's an improvement in their features?
Well, we have a variety of patients coming to the clinic, but most of the patients come because of dental pain. Patients' dental pain is such an unbearable pain. It is, according to statistics, it says that it is second in number to the labor after labor pain. So dental pain is highly intolerable. So when a patient has dental pain, he comes to a dentist. And this is the single most factor which brings a patient to a dentist. So it is more of a need-based practice. And there
Okay.
are certain class of patients which are well educated and which who knows the importance of regular dental visits. So these patients come to us for smile designing cases, for cosmetic makeovers, for bleaching, for teeth whitening, especially when they have to attend a wedding or a family function. So these kind of patients are also there. So, but I highly recommend that one should visit a dentist every 3 months. Once in 3 months, you have to visit a dentist, if not for just a checkup, but for a regular dental cleaning, which is an ultrasonic cleaning device. So regular dental visits is highly encouraged, and there are a very few class of people who don't visit the dentist regularly. They only visit at a time of emergency. And especially during the recent corona crisis, when we are locked down, many patients are calling me and saying, doctor, I have tooth pain, I have this, I have that. I said, why don't you visit when you don't have tooth pain, so that the cavity wouldn't progress to the tooth root canal or something like that. So I highly recommend that you should visit the dentist once at least in 3 months.
So regular checkups are a much needed thing.
Yes.
Okay. Doctor, I found you very much active over social media. Could you just tell us how this started and how you are growing yourself as a brand on social media?
Well, nowadays, today's generation is super active, especially the millennials are super active on Facebook, Instagram. So, according to me, I feel that dentists should not be an exception. We should cope up with the recent trends of social media. Also, there
Yes,
are many advantages
absolutely.
of media. Like we can reach out to so many people, which we cannot reach out by giving flyers or putting a poster. But everyone is having their mobiles on their smartphones on their hands, and they can easily understand the importance of oral hygiene, the importance of regular dental checkups by seeing the different posts on social media, which I usually try to promote it on my page. So you can just go through my social media page, and the handle is at Oramax Dental Clinic on Instagram and Facebook. So you can just see the different types of posts which I've created for my audience to enhance the importance of the oral hygiene and good dental care and regular dental follow-ups. So I also want to thank my dear friend Akash More, who is a digital marketing expert and who has helped me come on the top 10 top page of Google listing. He just helped me with adding a keyword of my phone number on Google listing, and that helped me stimulate my page to come on the top three. If you search best dentist in Juhu, Oramax Dental Clinic will appear amongst the top 3 categories on Google. So small inputs can bring a drastic result, and it took me for a while to learn and understand this digital marketing concept. But I must say it is definitely fruitful, and I see all my fellow dentists doing this and advancing, and they are taking help of social media to reach out to so many people. So am I doing it. So yeah, I must say social media is one of the very good tools in marketing yourself.
And of course, you require a digital marketing consultant like Akash. That's also obvious thing to let you know that where you are going wrong and how you can improve yourself on the social media platform.
Exactly, yes.
To end up with just a last but not the least, on a very important note with the pandemic outbreak, Doctor, could you tell us what measures you have taken in your dental practice to beat this COVID-19 outbreak and preventive measures or like that?
Yeah, that's a very apt question considering the current scenario. So there are many methods, and we have implemented a number of things in our clinic. Number one being we follow strict sterilization protocol and disinfection protocol by using Class B autoclave. So
Hmm.
autoclave is something which sterilizes all your dental instruments or whatever things you put in patient's mouth. So these are absolutely made free from all viruses and bacteria by boiling to a temperature of 121 degrees Celsius for 15 minutes. And we have pouches. We keep all the instruments in autoclave pouches so that it is sealed and it reduces the risk of penetration of germs. Number two being that we follow strictly hand hygiene, that we have kept hand sanitizers everywhere in our clinic, in the reception, in the sterilization room, in the inventory, in the operatory, so the patients follow strict hand hygiene as soon as they enter the clinic. Number three being fumigation. We follow strict fumigation, which is nothing but disinfecting the entire clinic by fumes of a chemical agent, which removes and kills all the bacteria and viruses. So we make our clinic free from all kinds of microorganisms. And we do this regular basis once in every month. Then we use PPE, which is personal protective equipment, such as mouth mask, has gloves, then head cap, then disposable shoe covers, personal protective gowns before touching to the patient. So we protect ourselves and the patient from cross infection. And number three, lastly, we are doing video consultation. During this lockdown period, our clinic is closed, but I am always available on video consultations through Skype, through Zoom, and all the WhatsApp. So I am offering my video consultations to patients who are in need of dental treatment, any dental emergencies. And if we feel that it's an emergency, then we can take up that patient in a clinic. Yeah, that's
Oh,
that.
wow, you are taking all the possible measures uh, into account while treating your patients when they come down to the clinic. But with the lockdown, what you told is really wonderful. You are offering video consultation as well, using all
That
the platforms. Really wonderful to know that. So a doctor is nearby through a video call, at least for now. Yeah, it was nice having you on the show, doctor.
Thank you so much.
Uh,
And I
yeah,
will tell our audience can follow me on Instagram. My page handle is at Oramax Dental Clinic. So you can see how all the precautions I'm taking during this recent corona outbreak. You can see a video which I have put it on my page. And yes, Sheshgiri sir, I would like to thank you very much for having me over this video conference and for this lovely interview. I
yeah.
hope this brings some good light, and it was a piece of useful information to all my audience.
It was a pleasure having you over this, Dr. Kaushal. And I just want to tell my audience that I'll be sharing your contact links in the description of the link of the video. Thank you.
So, thank you very much. Bye bye. Take
Thank
care.
you. Bye bye. Take care.